Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about metabolic syndrome. In particular, I will cover what is metabolic syndrome, how you treat metabolic syndrome, and how you can better live with metabolic syndrome. So we start with what it is. Metabolic syndrome is a cluster of conditions. So to be increased blood pressure, elevated insulin levels, excess body fat around the waist, or abnormal cholesterol levels that occur together, increasing your risk of heart disease, stroke and diabetes. So having just one of these conditions isn't diagnosed as metabolic syndrome, but it does contribute to your risk of serious disease. If more than one of these conditions occur in combination, your risk is even greater. If you have metabolic syndrome or any of the components of metabolic syndrome, aggressive lifestyle changes can delay or even prevent the development of serious health problems. So the symptoms. Having metabolic syndrome means you have 3 or more disorders related to your metabolism at the same time, including obesity, particularly around your waist, a systolic blood pressure measurement higher than 120 millimeters of mercury, or a diastolic blood pressure higher than 80 millimeters of mercury, an elevated level of blood fat called triglycerides, and a low level of high-density lipoprotein cholesterol, or the good cholesterol. Resistance to insulin, a hormone that helps to regulate the amount of sugar in your body. Having one component of metabolic syndrome means you're more likely to have others. And the more components you have, the greater the risks to your health. Metabolic syndrome is linked to your body's metabolism, possibly to a condition called insulin resistance. Insulin is a hormone made by your pancreas that helps control the amount of sugar in your bloodstream. Normally, your digestive system breaks down the foods you eat into sugar or glucose. Your blood carries the glucose to your body's tissues, where the cells use it as fuel. Glucose enters your cells with the help of insulin. In people with insulin resistance, cells don't respond normally to insulin. The glucose can't enter the cells as easily. Your body reacts by churning out more and more insulin to help glucose get into your cells. The result is higher than normal levels of insulin in your blood. This can eventually lead to diabetes when your body is unable to make enough insulin to control the blood glucose to the normal range. So even if your levels aren't high enough to be considered diabetes, an elevated glucose level can still be harmful. In fact, some doctors refer to this condition as pre-diabetes. Increased insulin raises your triglyceride level and other blood fat levels. It also interferes with how your kidneys work, leading to higher blood pressure. These combined effects of insulin resistance put you at risk of heart disease, stroke, diabetes, and other conditions. So, combination of factors. Researchers are still learning what causes insulin resistance. It probably involves a variety of genetic and environmental factors. Some people may be genetically prone to insulin resistance, inheriting the tendency from their parents, but being overweight and inactive are major contributors. Disagreement among experts. So not all the experts agree on the definition of metabolic syndrome or whether it even exists as a distinct medical condition. Doctors have talked about the cluster of risk factors for years and have called it many names, including Syndrome X and insulin resistance syndrome. So next is, how do you treat metabolic syndrome? Treatment methods include dietary changes, exercise and activity, behavior change, and prescription weight loss medications. Weight loss surgery and tackling one of the risk factors of metabolic syndrome is tough. Taking on all of them might be overwhelming. But aggressive lifestyle changes and in some cases medication can improve all of the metabolic syndrome components. Getting more physically active, losing weight and quitting smoking help reduce blood pressure and improve cholesterol and blood sugar levels. These changes are key to reducing your risk. So for exercise, doctors recommend getting 30 to 60 minutes of moderate intensity exercise, such as brisk walking every day. Lose weight. Losing as little as 5 to 10% of your body weight can reduce your insulin levels and blood pressure and decrease your risk of diabetes. And eat healthily. The dietary approaches to stop hypertension, the DASH diet, and the Mediterranean diet. Like many healthy eating plans, limit on healthy fats and emphasize fruits, vegetables, fish and whole grains. Stop smoking. Smoking cigarettes increases insulin resistance and worsens the health consequences of metabolic syndrome. Talk to your doctor if you need help kicking the cigarette habit. And medication. The prescription medicine Xenacol can be used to assist in weight loss. And finally, how do you live with metabolic syndrome? You can do something about your risk of metabolic syndrome and its complications. Diabetes, stroke and heart disease start by making these lifestyle changes. So lose weight. Losing again as little as 5 to 10% of your body weight can reduce insulin levels and blood pressure and decrease your risk of diabetes. And exercise, again, the 30 to 60 minutes of exercise, and again quitting smoking, as cigarette smoke increases the insulin resistance. So eat fibre-rich foods. Make sure you include whole grains, beans, fruits and vegetables in your shopping list. These items are packed with dietary fibre, which can lower your insulin levels. And finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing metabolic syndrome more effectively on a day-to-day basis. To start with, we have numerous products to get you started on an exercise program, such as an exercise ball, floor mats, weights and various other items to get you up and running on a program we create together and is tailored specifically to you. We also have various supplements and products which you can buy or purchase from us without a prescription, such as psyllium husk, omega-3 fish oils, ginseng, berocca, CoQ10 and magnesium. And we also stock light boxes to promote relaxation and improve mood, blood pressure monitors, blood sugar monitors and body fat monitors and assisted living devices. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new service, a telehealth clinic. You can book a 30-minute clinic with us and we help to increase your understanding of your illness. So during a telehealth clinic together, we create a cohesive management plan which enables you to take a more active role in managing metabolic syndrome with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas in Cork or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.